Up next, opiate addiction is now a concern in communities across the nation, certainly, but heroin and opiate addiction has long been an issue in the northern New Mexico community of Espanola. KUNM public health reporter Ed Williams spent several months in Rio Arriba County last year getting to know individuals, families, and community leaders who have dealt with the opioid epidemic for generations. He sat down this week with our producer, Sir Gustavus, to talk about his series, Enduring Addiction, that airs this week on KUNM.
Ed Williams, thanks for stopping by.
Thanks, Sarah.
Last year, New Mexico officials announced there was a reduction in opiate overdose deaths in the state, but you found in your reporting on this issue that the numbers don't exactly tell the whole story. What do you think people should know about that? Yeah,
I mean, it's true that the overdose numbers are decreasing, and that's definitely a good thing. But I mean, just focusing on the decrease, I think, is a little bit misleading. When the CDC first started taking track of these numbers reliably in the late 90s, Espanola was the highest overdose rate in America. I mean, second to Baltimore was second, you know. And now the number is still 50% higher than it was back then. And so the issue is just that compared to places like West Virginia, I mean, we're starting to look a little bit better on the numbers. But, you know, I think just talking about this epidemic in terms of numbers of overdoses by itself is kind of just maybe not the right way to frame it. It doesn't mean that drug use is down, just that fewer people are dying from taking too much heroin.
And one of the reasons why is naloxone. It's this drug that's available that can help reverse an overdose deaths and save lives. How has that changed the fight in Rio Arriba County?
Well, a lot of people are getting naloxone now, which is, I mean, where most of the federal money has been going, and state money as well, has been going to naloxone, which is kind of a miracle drug that you spray in the nose and can save someone's life. And I don't want to underplay how important it is, because almost everyone I talked to for this story had an overdose reversed by naloxone, which is really staggering to me. But at the same time, I mean, detox is being starved. Treatment is there's hardly anywhere to get help. And so we're turning people away from getting help, and then they're overdosing, and that's where we're investing our money. That's where we're putting our finances and our efforts here. So naloxone is available. It's really important. Police are carrying it. It's saving lives, but the root causes of the situation are still very much there. Naloxone doesn't help your hepatitis C. It doesn't help your cardiovascular problems, all the emergency room visits that take place for complications from heroin that aren't overdoses. So it's still a very serious issue there.
You mentioned treatment. For folks living in Espanola or Rio Arriba County, if they decide they want to go into treatment, is it available in their community?
I mean, the short answer is no. I mean, this is really the bottom line, I think, for a lot of people here, is that I talked to some counselors at Inside Out. They're the ones that kind of try to place people into treatment programs. They told me that about 9 times out of 10, they have to turn someone away who's trying to get help, who's trying to get clean. And remember, this isn't a drug you can just quit. And because the detox is almost always full, there is no medical detox in Espanola. People are having to drive to busy parts of the state, like here in Albuquerque. They're not able to get into treatment programs.
What's medical detox? What's the difference?
So that's a good question. I'm glad you asked it. Medical detox is for people who have severe withdrawal symptoms or are at kind of a medical risk for a treatment program. You got to make sure that someone's not going to die in the bathroom, you know what I mean, while they're trying to get help. So you need a hospital clearance. There's social detox, which is the other one. There is one of those in Rio Arriba County, Oi Recovery, but they're not able to take people who are high risk. So medical detox takes place in a hospital, and it's funded by Medicaid. So it's a big money saver for the state. And the problem is there are no such medical detox centers in Rio Arriba County. So the part of the state and of the country really with the highest rate of opioid addiction doesn't have anywhere to go now for treatment, for detox, which is step one if you want to get better.
Also, the state continues to struggle financially. There's a lot of talk about the future of Medicaid, including here in New Mexico. What's at risk? What's at stake here when it comes to drug treatment?
That's a really big open question right now, I think. I mean, we have Medicaid solvency issues at the state right now, and now there's a question of is the Medicaid expansion in jeopardy? Is it going to be a state block grant? I don't know the answer of what that would mean, but what people generally seem to think is it would mean less money. And that's how a lot of people pay for their recovery is Medicaid. I mean, this is one of the poorest areas of the state, so a lot of people don't have a way on their own to pay for treatment. And so hopefully it won't be a huge impact. I mean, I don't know. People are worried about it, but no one really seems to know the answer at this point, at least.
I think most New Mexicans know there is a lot of heroin and opiate addiction in Rio Arriba County. We've been hearing about it for years. What do you hope people will learn from your series, from hearing directly from these people who have been dealing with this for generations?
Well, first, I mean, I think this is a story that is a profoundly human story. Like, these are wonderful people who are going through these really profound struggles. What's underlying all of this, it's not just an issue of addiction, of chemical dependence, right? I mean, there's profound social vulnerability in this community. I mean, child poverty, childhood trauma, incarceration, all this instability that kids and families are going through because of addiction. These are the things that really need to be looked at if this epidemic's ever going to actually end. I mean, treatment alone, even though we need it now, it's not going to solve the root causes of the problem. So that's one thing I think we could be looking at right now as New Mexicans.
Ed, we appreciate you stopping by to talk about your series. We're going to put up a link to your stories online at newmexicoinfocus.org.
Yeah, thanks, Sarah.